Hey, you guys. So I am back. I actually, it's been a minute, but I know I needed to get back with you guys. I am actually outside so I can have some peace and be able to talk without interruption. I have kids over and it's a big party. So, anyways, the summer has been great, you guys. It's been a blessing. Let me take this off so you don't have a reflection. So, anyways, I'm about a week and a half away from being done with the second semester. So, what we have left is one exam. And then we have two final exams, and this is one in pediatrics and one in maternity. So there's not much left, honestly. So what we've been doing is basically virtually online, and it hasn't been bad. I don't want to say it's been bad, but just only having one day of clinicals, you guys, this is why I wanted to do this tips and tricks on clinicals, because now that we're online, there's not a lot of experience you're going to get in the clinical setting. So this is why I wanted to go ahead and make this video so you can make your time useful, and that you are up to date, especially with the COVID-19 policies and having to wear the mask everywhere you go. It makes it harder for you to think because you've got this mask on, you're trying to breathe. I know once I get started, I don't even think about the mask being on. It just becomes normal to me as I'm doing clinicals. But other than that, we really don't go anywhere. The only thing we've really done for the summer was go to the lake, and nobody was there. So it was just us and the kiddos, and we had a good time. With that being said, that was about it as far as going to church and coming home, doing homework. And there's a lot there's a lot of homework second semester. I believe the longest assignment we had was like 12, 16 hour assignment. We have practice exams. It just gets harder and harder, and they are counted as grades, so you don't need a zero in nursing school. It doesn't matter if it's homework or an exam. So yeah, let's get started with the tips and tricks. So number one is don't argue with your instructor. Let me say that again. Do not argue with your instructor, especially if it's in front of people. It just looks so unprofessional. And for the fact that we're all frustrated as it is, we all got a lot going on. If you're just really questionable about the things they're asking of you, because it seems overwhelming. The paperwork you have to fill out, the narratives you have to fill out, you have to fill out medication orders, you have to fill out doctor's orders, usually on more than one patient. But as of right now, we only have one patient that we're really just documenting on. And so the best thing I could, encourage you to do is, if there's just that one instructor that it just seems like it's just not going good either way it goes, just pull to the side. Make sure, it's professional and you're doing it as honest and as genuine as you can, because life is overwhelming as it is. So number one, respect your leaders, respect the nurses that are taking the time out to educate you on how to be a good nurse. And if it does become overwhelming, take a step back, pray about it, and then address it when it's time. Okay, so that's number one, getting that out the way. I just as, someone just in the student nurse field, I just wanted to put that as number one. So then we have number two. Prioritization is the best key. And when I mean prioritization, I mean make a to-do list. Nobody really tells you how clinicals is supposed to go. What they do is they say, hey, I need this, and this, and you have to basically prioritize. So let's just say we're coming into clinicals. It's 6 in the morning. Everybody's checking in. Your clinical instructor says, hey, you have room you have room blue, you have pod 1 or pod 4 or pod 5. They have 5 patients or 4 patients in this one pod. They assign you one person to document or whatever. Number one, if you have only one patient to document on, and I was bad about this and I'm just now learning it. second semester. So this is why I want to, basically let you guys know how it's going down in clinicals. If you have 5 or 4 patients, however many patients you get, but you're really assigned one to document on, one to narrate on, one to give meds, or even just look at the meds, you need to make sure you know as much as you know about that one, at least by 8 o'clock. Let me say that again, at least by 8 o'clock, because what they want you to see is, one, what are they in there for? What's the diagnosis? 2, the history. What's been going on with this person, that brought them into the hospital now, and what happened previous in their lives? How old are they? Are they male or female? Are they white or black? A lot of the things that we're studying in nursing school, even from foundation, is that a lot of it has to do with genetics. A lot has to do with heredity. The other stuff is that things they've gained throughout life, like obesity, gained throughout life, like diabetes mellitus. Is it 1 or 2? Things that you are viewing in the person that they have over for that one particular clinical. You are lining out your meds, your MAR. Now, this is not something you do, just right off the top of your head. You may just, get the meds down on a sheet of paper. Normally you have a plan that has your MAR down, and you get that MAR down, and what you do is you want to line up, why are they taking Zofran if they're, in for just high blood pressure, because this is a med they've been taking before they got here. What's the history behind that Zofran? What's the history behind that, Ativan, or, the Protonics? Why are they taking Protonics and, they're on a surgery floor? Why is the doctor prescribing, a Lipitor? Things like this you want to look at whenever you're checking your MAR. Is it the history of the person, or is it the diagnosis they're in right now? So you want to prioritize your to-do list for that one person. Yes, you get a call light on, and yes, your CNA may ask, hey, did you get everybody's vital signs? But if the clinical instructor says, hey, you have room so and so, and they come up to you and you've been like, oh, I've been in another room trying to do something else for someone else, then it's not going to look good on you, because the prioritization. Now, I can understand, because me being in the clinical setting right now, and at the end of the second semester, where I know how to pass meds, I know how to do catheter, I know how to do a lot of things. And yes, they say experience is everything in clinicals, because you really don't get a lot of experience. Well, a lot of stories, people don't get experience. But at this time, even just within, one day a week, I get a lot of experience. And there's tons of times where, you can do the IV, but I have not even made it there yet. But there's tons of times where I could have. But you only do what you're allowed to do, what you have checked off, and you are able to do as a student nurse. If a nurse tries to get you to do anything other than that, then say, you know what, no, sis, I can't. I have not checked off on that. It'd be awesome to watch you do it. If you have time to watch that nurse do it, then yes, get all the technique, get all the learning you can. But a lot of what you need is before 8 o'clock. And this is why I'm making this video, because I don't see anybody else doing this video. A lot of videos out there are really stressing like what to bring to clinicals, what to expect from other nurses, but really what you need to know for yourself is to prioritize and to make sure what you hear from the instructors, what you need to know. Being in pediatrics and maternity, I was on labor and delivery for the first semester. For the first part of the second semester. So it's about a month and a half. And then come July, I switched into med-surg, and we're going into med-surg and surgery and the ER come next semester, which is our final semester. And so just learning these things now, so when it becomes two, three, four patients, I've already prioritized the meds. I already know now, like, why I'm giving the certain meds I'm giving, even if it has nothing to do with the diagnosis of why they're here right now. But oh, they used to, they're diabetic, or COPD, and this is why they have the inhalers, or this is why they're on 2 liters of oxygen, or 100% nasal cannula, or whatever the case may be. So you're not just kind of like, I don't know why I'm giving Lovenox, and they're just here for something, not related to that, but their history lines up with why they're getting that med. And that's why you want to do your homework. That's why they tell you to look up this medication. What does it mean? Why are they taking it? You can get, an convulsant. You can get gabapentin, and it actually be, like a way of taking it as an analgesic for pain. They don't necessarily need narco, even though it's on the list. Has it been 4 hours? Do they just need to take something, a little less stronger to get them until it's to the 4 hours? And this is all of what I've learned up until now, and how it is so important you understand why you're giving medications, and why you're doing it in the first place. So, and then we move on to either tip or trick, whatever you want to call it. Tip number 3, whenever you have that prioritization down, remember to, if you do not even follow the list, check it off. Make sure that, hey, this is what I've done, and it's, I've done the vital signs. Let me check that off. Because when you come back to the to-do list, and then you see like a list of stuff, and you're like, oh, this is a lot. You want to make sure you're crossing it off, so you don't get overwhelmed, and you're actually knowing, okay, what is it I need to do next? If there's not a long list, don't worry about it being long. Just let it be the list that it is. When you come in at 6:30, you have the patient you have. You stand at the nurse's station, and you wait to see who has your pod or who has your room. You get a report from them, and you make sure you have down what you need, and then you rock on. You go and get those vital signs for the nurses. If you have not made it to vital signs and you're just changing bedpans, you need to put your eyes on your patient. That's number one. Because as student nurses, we have not learned anything yet. So you want to put your eyes on your patient, and see them and know who they are. So when you do pass meds, and, they take orange juice with their medication, rather than, a glass of milk or whatever, depending on the medication. You need to know that right off. A lot of the times, water will do. So if you have medicines to give in that whole pod, you need to go ahead, and if you can't even give medications, make sure they have their glasses full of ice water for that nurse that's going to come around and give them medications. And so you've done your part. You've at least given, everybody has glass of water. We, in our local hospital, they have these jugs that the hospitals give out. And so the very first thing I do when I'm taking vital signs, I go, hey, do you need some water, some fresh water? And 9 times out of 10, it's a yes. Like, you just woke them up. It's about 7 in the morning. They need something to quench their thirst. But then also, when you come around 9 a.m. to give meds, you already have a glass of water there sitting there for them to be able to take their medications. And you're not like, oh, I'll be right back, I forgot. You're taking meds. Let me go get you something to drink. And it could be something so simple. If they're NPO, they're NPO. A lot of it is IV pushes or whatever. It just depends on what you're giving the patient. And 9 times out of 10, NPOs are chewing on ice, or something very simple, but they can take their by mouth pills. So it's just really understanding nursing, and understanding it. Me just only being in it for just a short period of time as a student nurse. The repetitiveness, the getting, it didn't take me long to understand what they have going on. So anyway, so that's tip number 3. Make sure you're checking off that list. If it's not a long list, it's okay. If you've done everything on your list, it's okay to take a 15-minute break. It's okay to say, hey, so and so is okay, and I've checked on so and I'm just going to take a 15. It's okay to take a break, because as a nurse, you have to think 24/7 while you're here. And so it's okay to take a second and step back and go, okay, I'm done with round 1, or I'm done doing what I need to do for the morning, before I go again and check on them for the 15th time. Let me take myself and check on myself. Let me take a snack, or whatever it is. It's okay to take a break. That's a tip or a hack, or just whenever you need it. There it is for free. And sorry, my homegirl is calling me. I'll have to call her back. But anyway, so and then we move on to tip number 4. Whenever you have the MAR, you have the to-do list, you have, when you're writing the head-to-toe assessment, I cannot explain to you how important it is to make sure you do the head-to-toe assessment one. And as you are doing it, write it down. Some use it as a memory bank and they leave it outside the room. As a student, you want to make sure you cover all your bases, because for me, in looking at the paper, writing down what's going on in the narrative assessment, which if you haven't gotten to it, you will get to it in nursing school, but it's a sheet where it's head to toe. Literally, you're checking out the scalp. You're making sure that the eyes dilate with the pen. You're going to make sure that the nostrils look good, the mouth looks good, and they can, I had a patient the other day. I was concerned because they had an abscess tooth, and when I looked into the mouth, it was kind of hard to see. And so it's very important when you do the assessment, because I had to write that up. That was a concern for me. And so I let the other nurses know. Every time you have a concern, you want to let the RN, the LVN know what's going on with the patient, because especially if you're the first one in there getting vital signs, something looks sketchy or something doesn't look right, they could code at any moment. Something could happen in a second. I mean, it's nursing, not just nursing school, but it's real life nursing. So anything could happen. So you need to be aware and have that in the back of your mind, that you need to do everything correctly, because first of all, you have no career yet to have cost you anything, but just, as a person to person, I wouldn't want to cheat it just because, there's always something demanded of you. It's going to be like that 24/7. That's the field we're in. Sorry for the background. I'm outside because of the kids, but and that's just what I wanted to get to. Is just making sure that you do everything correctly in the narrative assessment. Just do the assessment, get it done, and do it to the best of your knowledge. Listen to those lungs. Make sure there's no crackles or wheezes. When you're listening to the heart, make sure there's not a murmur or an absent beat or something's going on that is abnormal. Document it and let a nurse know. Because this is what we're doing. We're not necessarily, saving the life, but, if we can prevent anything from happening, that is exactly what we're doing. We're preventing anything from getting worse. And that's why we're here. And so once you get all that paperwork done and everything, you've taken your break, it's about 12 o'clock, everything, the meds are passed. You've done a great job. Don't expect it to just go, great from here. Anything could happen and go downhill. Let me just tell you, anything could happen. And so you need to be aware while you're on the field as a nurse. Just be aware of your surroundings and make sure that you're paying attention to your patient, to yourself, and being safe. If anything feels sketchy or if anything just does not feel right, no, nothing has happened to me as of right now. But just trying to give you an update and an insight, and just, what God is giving me, I want to give to you, because it's not necessarily just the safest, because everybody is on edge with COVID. Everyone's on edge with not being able to see their families, and you just never know what's going to happen. And so you always want to be aware, not just fearful, but aware. And so, I just wanted to give you these few tips, you guys. I have not seen you in like forever, and it's just exciting me to be able to get back on the horse. Y'all, it's a lot to be in nursing school. I know you see me and you think, hey, why haven't we talked in a while? Sis, I'm in nursing school, and it takes a year, and there's a lot of things that I had to, let go, including friends. It's not easy. It's not easy. A lot of friends I've had to let go. Not to say that I don't communicate with a lot of people. I do. I try to definitely keep those ties. And I've definitely done a lot that, some people be surprised, like, you're in nursing school still. Some people be super surprised what I've actually been able to do. But at the end of the day, do not stop. Keep being motivated. Keep doing what it is that you are wanting to do, and accomplish it with a type of pride and courageous. And there are so many people that did not make it even this far, and I'm so grateful that I am here, and I can give report back to you guys. It is so important that you understand what is required out of you just in nursing school, and how you have to build up and fill the shoes. It's I wasn't even going to touch on it, but it's important to me to say that my mom, y'all, I actually had to do clinicals one day with my mom, and it was amazing. Her ability to quickly address and assess things as a nurse, it's amazing. It's amazing. And I get fearful because we're on her floor right now, and I'm like, oh, I hope my mom isn't here, because those shoes are hard to fill. And the nurses, they all are like, as soon as they see me, they're like, oh, there's so and so's daughter. And I'm like, oh, I just, as a learning student, there's a lot I know, but there's a lot I don't know. And I will not go ahead and do something because if I don't know, I don't know. I love to ask questions. I like to make sure I'm doing things the correct way. This is how I learn, and this is how I don't want to, I stay humble no matter who it is I know. There's so many people that work at the local hospital that I am clinically, at right now, and I just stay humble. Like, I don't want to say, oh, I know, there's so and so and there's so and so, but no, boo, I could let you down so easily. So I don't want to point you out for that simple fact. Because I could let you down, and I don't want to be that way. We all want to carry our own name. We all want to be successful in our own way, and so I just want to thank my mom for being an awesome mom. But honestly, you guys, this is it. We're coming around the home stretch. The last leg is being pulled. We'll have a little break, like a 2-week break. But as of right now, I got to study. I got to make these A's so I can push on to the next semester. Right now, I'm doing great. I've got B's, and my clinicals is going well. Not really worried about anything other than just taking that time for my family. My family is being stretched to the max, and I'm so glad it's almost over. But God is good, and He never fails us, you guys. Keep praying for me. I'll pray for you guys. If you have any questions or any comments, make sure to put them down below so I can be able to address them as I see them. But other than this, you guys, I just wanted to make an update and let you guys know how it's going, give you some tips and some tricks because I wish I would have gotten them. But anyways, you guys, have a good day. Happy nursing.